speech language pathologist, and neurorehabilitation specialist. Today, we are going to explore how to escape fatigue and stress. Welcome, Dr. Sarah.
Thank you so much for having me.
My pleasure. My pleasure. Now, I understand that you've been through your own journey of healing and multiple brain injuries. Uh, what was your experience?
Well, I was actually born with a brain injury, and I had several more throughout my childhood and young adulthood. And so they kind of stacked on top of each other. So by the time the last brain injury occurred, which was a car accident, it kind of turned my world upside down. Some of the things that I struggled with are very common symptoms that people that experience brain injury have, like fatigue and light sensitivity, sound sensitivity, nausea, dizziness. Um, I also had something called anomia, which is the inability to retrieve words. And I also had some difficulty with memory and organizing my day, planning a lot of things. What's interesting is that on the other side of that, the clinician needed to become her own patient because it was at that point that I had to essentially use everything that I had ever learned and apply it in a new way. In many ways, I had to start from scratch, and experiencing that as somebody that was going through it radically shifted my perspective on what it means to be somebody recovering from brain injury. And so it really transformed the way that I work with not only people that are experiencing brain injury, but all of us, because we should really honor each other and how none of us really experiences reality and life in the same ways. It's all based on our experiences, and there's so many things that go with that, whether it's biology or your energetic system. Um, so in my experience, healing from that brain injury was just something that I really thought was kind of out of reach when I began the journey. And now, knowing all of the things that I know, it allows me to share it with as many people as will listen to me talk.
Well, I'm glad you said all of us because that brain injury that you had in a car accident sounds like every day of a business owner's life. They start out going for a wonderful journey in business and they get rejections. Every day they get new competition. They get people resigning and people stealing from them. And they're sleep deprived. They got fatigue. They got brain fog. They're trying to think long term, but they're lucky to be able to focus just one step ahead. And so I'm glad you said that's all of us.
Absolutely. Absolutely.
You mentioned also with the brain injury, there was light and sound sensitivity. How did that impact you?
So for me, I still experience light sensitivity. I have to have sunglasses on my head anytime I leave my house. That's a symptom that hasn't resolved. The sound sensitivity, really, my nervous system was quite rattled after everything that I had been through, and it can get into a place where that fight or flight, that activation of your sympathetic nervous system, we're so used to being stressed, right? We're so used to things coming at us that it can almost feel like second nature. And we can almost forget what it feels like for your nervous system to be in balance. And for me, after that last brain injury, any sound, um, it's comparable to when we were in school. I'm sure you remember when people would take their nails on the chalkboard and they would run it down. And there's some people that could hear that sound and they would be pretty okay with it. But then you would always have that subset of people that would not be able to handle that sound. And
I've got the goosebumps on my legs now. I can feel the memory.
Absolutely. And so, sound sensitivity after brain injury, it's like my body was responding to that not only with nails on a chalkboard, but with everyday sounds, the closing of the refrigerator, the ringing of the phone, a child laughing in the distance. It all became it felt like an assault on my nervous system because everything was so raw. So, a very important part of my journey was learning how to regulate my own nervous system.
Mm. That that sound sensitivity, I believe that living in an urban environment, we're constantly exposed to sound. And I notice here in Taiwan, I say that it's quiet, but there's this low level hum all the time. It could be the hum of the electricity, it could be the fridge, it could be the computer, but you can't escape the sound. And sometimes I leave the city and I go to the mountain and I get outside and I realize what silence is. And I can feel my body shifting
Mhm.
from the sympathetic nervous system over to the parasympathetic, and it just relaxes immediately. And it's such an unusual experience because I'd tell you it's quiet here, but it's loud. There's
Right, I
always
know.
a noise. And the same thing that I think a lot of people experience working in the city, it feels like anxiety in the body.
Mhm.
The constant sound of the
Mhm.
bus, that low rumble, the high pitched sound of the brakes with the metal on the
Mhm.
metal, the
Mhm.
bipping, the talking. Nenny and I, we went to the city recently and we were both exhausted. It's only a
Mm.
45-minute journey away, but by the time we got back, it was like, I have to sleep. I was just exposed to so much information, sound information coming at every direction from every frequency from maybe down here at 8 hertz all the way up to 48,000. Exhausting. So exhausting.
Absolutely. And we're affected by things that we can't see, right? So
Mm,
there's EMFs, and our electronic devices give off signals, and we got Wi Fi everywhere, and we got Bluetooth signals everywhere, right? So even beyond just the lights humming and the refrigerators humming, all of the stimulus that the human body has coming at it. If you look historically, it's not been so relatively new for our human bodies to catch up to all of this large change of incoming data constantly, right?
mm,
And society just like takes it like it's just a normal thing. But I personally, I don't feel that our human bodies were designed to multitask and have the level of intensity and really insanity in a
mm,
day that many of us just live because this is the way human beings have decided that this is how we do life. This is how we do work. This is how we travel. This is how we, you know, and a lot of times it's not helpful. It can be detrimental too. And I love
mm,
that you go out and you get away from all of that and you connect to the earth, to the silence. That's what we're designed for.
mm. It's like that Schumann resonance frequency. The Earth has a pulse, 7.83. And even here in our house, we constantly use a Schumann resonance frequency so we feel grounded.
Mhm.
And what we found was that when we started to use frequency inside the home, the tension in the house lowered. You could actually walk inside and you go, it feels different.
Mhm.
The kids have relaxed. We sleep better. And I also believe that it's impacted our animals. Our animals are very well behaved and they're chilled out. But I believe that the energy in this house is constantly being neutralized, kind of like a good set of noise cancelling headphones. I'd never had noise cancelling headphones, and I bought a pair of Samsung Bud Pros recently, and I put them in, and it cancels out all the noise. And I heard silence inside the house. I was like, this is fantastic. And even today, I'll walk around the house with them on just to get that silence. And it's very unusual to have silence in such a noisy environment, but the body relaxes. You can feel it in the muscles.
Absolutely. And I'm really glad you brought up the Schumann frequency because, human beings were kind of designed to be tuned to that. And we're talking a lot about modern life, and now we have rubber soled shoes, and we have tires on our cars, and we have all of this insulation. And historically, human beings walking the earth, our feet were in contact with the earth. We were able to have an exchange of energy with the earth that now in 2025, many people don't do. So, if you can get outside for 20 minutes in bare feet and let your feet touch the earth and breathe in fresh air and tune yourself to the frequencies that are all around you, that's one positive step toward health, and, well, they all add up.
Mhm. It does compound. I've gone for a walk uh, in the park here, taken off my rubber-soled Birkenstocks with the foam of the cork thing which separates me from the earth, and I put my feet down on the grass, and it feels unusual. It feels unnatural because the feet haven't been bare on it for so long. I try to walk across the rock pavement because here in Taiwan, when they pave the ground, oftentimes I'll put different large stone pebbles in there. So it simulates walking on natural ground. And I put my feet on there and I feel the bottom of my feet for the first time. I feel the
Mhm.
arches, I feel the balls, I feel the gaps between the toes, and I'm hopping. It hurts. You bounce around for a bit, but then you start to realize that that's actually what it must have been like for the generation just before us.
Mhm.
There's nothing that I have in my cupboard that would get me close enough to Earth. Might have Birkenstocks, I might have some really good cowboy boots,
Yeah.
but I'm separate. Got to rejoin again. What about the light sensitivities? And the reason why I ask that is I have a good friend and a client. His name's Christopher Bellamy. About 2.5 years ago, he was diagnosed with a brain tumor. And after his radiation and chemotherapy, he ended up with radiation necrosis on the brain. And he had similar sound and light sensitivities like you. If he heard a cup drop in the background or in the kitchen, it could trigger a seizure.
Mm.
The sensitivities were so great that for 2.5 years after his surgery, he was still wearing earplugs to cancel the noise.
Mm.
Even the light sensitivity, he was wearing sunglasses all day, every day, even at nighttime,
Mm.
because even light could trigger a seizure for him.
Mm.
What's happening in the nervous system?
Well, seizures are generally caused, it's like having an electrical storm. So your brain has electrical signals, um, and a lot of things can cause seizures. It can be a structural reason, it could be infection, it could be brain damage. When we're talking about the brain, it's really and truly such a complex organ. You can touch any one place on your scalp, and it doesn't do the same thing as any other one place on your scalp, right? Um, the light sensitivity, I'm not real sure about this particular client and their particular seizures, but I know that the light sensitivity is often also gonna be related to, the eyes and the way the optic nerve travels contralaterally to the back of the brain and your vision centers in the back of the brain. And, perhaps perhaps this is just something I haven't figured out how to fix yet. I say that because many times I've had health challenges that were just like puzzles, and it didn't seem like there was a way to fix it, but lo and behold, I was able to undo that puzzle, um, and fix it. And for me, the light sensitivity is still a challenge. Me, myself, having multiple brain injuries in my lifetime probably makes that road for me a little bit more difficult than some of the other things I've been able to overcome more easily. So for me, I've needed to, compensate. So, for example, as we are on the podcast right now, I have a ring light, right? There's a ring light so that there's good illumination, so that your audience can see my face really well. Um, that's not causing quite a migraine, but it is most definitely makes my eyes burn almost to kind of be on here in this way, which is okay, right? Because I this is life. I've had to make some things adjustments, like the sunglasses when I leave my home,
Mm.
or to not put my gaze more closer to that ring light, to put my eyes in a specific position, at a specific place that I have figured out works for me, that will not trigger a problem with the light. So I don't think any two people are the same. I think everybody, again, experiences life and their body just a little bit differently. So those things have worked for me. Um, and keeping your lights in this particular circumstance, it's appropriate for me to have that really white light beaming in my face, but ordinarily I would never do that.
Mm.
I keep the lights a lot dimmer, and in the evening, I favor more red light because that allows your brain to get in alignment with those circadian rhythms, and that's just a fancy term for your body's kind of designed to work with rather than against the moon and the sun. So getting in line with that and that red light, it mimics the sun setting. So your
Mhm.
brain can start to relax and create those neurochemicals like melatonin to help you get rest.
My father, who was a farmer, would say, "A red sky at night is a shepherd's delight, but a red sky in the morning is a shepherd's warning."
Hmm.
So if they had the red light in the morning, the bad weather was coming. And it is interesting, isn't it? With a lot of LED lights today and these blue lights in the mobile devices, they're constantly sending that signal to the brain that it's still daylight outside.
That's
And
right.
people who are trying to veg out, like I do, you're trying to escape from the stresses of the day. You start to flick through social media, do a little bit of doom scrolling, watch a little bit of YouTube, but your eyes and your brain are getting blasted with that blue light. So you think
That's
you're
right.
fatiguing yourself, but that production of melatonin is held back. It's not released because the brain's still thinking it's daylight. And I know the difference if I prepare for bed with some good sleep architecture. Let's say it's 9 p.m. If I turn the devices off and just listen to some different types of frequencies to prepare for sleep, and I play a game of solitaire, by 10 o'clock, I'm knocked out and I'll sleep all the way till 7 o'clock. But I could do the same routine, but just have the phone on and that blue light. I might fall asleep at 10 o'clock, but I'll be awake at 2 o'clock in the morning. I'll be
Hmm.
wrestling around and I'll be awake again. It's like I've had a hit a cortisol saying get up, and I'm always sleep disturbed. So light's interesting. I was having a lot of problems with styes in my eye during the pandemic, and we were doing these long trainings. My bright light's only 1.5 arm lengths away, and that would be blasting from both sides for 8 hours. And then eventually I had traumas in the eye. I was waking up with dry eye and the eyelid would be stuck to the eyeball and I'd get this tear. And
Mm.
I was at the eye doctor and I looked at his records the other day and I counted about 32 times that I had been to the specialist eye doctor over about a 2 year period. And I kind of got the message after going to hospital multiple times and having my eyes covered for 24 hours to 48 hours straight. I thought, this is not good. This is not healthy. I got to get out into the daylight. And what I found was going for a walk early morning, especially with the kids to school and getting that direct sunlight,
Mm.
made a big difference to
Mm.
my eye health. I then also started to bathe in some um, volcanic water. So here in Taiwan, we're very much of a volcanic island. And we have both hot thermal and cold thermal springs.
Mm.
And once I started to bathe in those, it started to replace the minerals back into the body. So I could feel the minerals on my skin. I could feel it getting absorbed into the body. And every time I went to the natural pools, the style would disappear on its own. And it disappeared. But it was just getting back in touch with nature. Imagine this: we have a hotel, and it's called White Sands Hotel, and it's fed by natural spring water. So we've got springs in the pools, in the spas, but it's also right on the beach. So we go into the spring water, and it looks like your normal Olympic swimming pool, but it's all fed with spring water. All these minerals. It's got anti-aging, anti-inflammatory properties in it, and it feels
Wow.
so good. It's like
That
I've lost a
sounds
kilo.
lovely. Yeah.
It's delicious. It's good for the skin. Some people from Japan come over and certified it as one of the only hotels in the country that has that particular spring water in it. It's amazing. You feel it's like this nice protective layer on the skin. Health, as you say, isn't one dimensional. What does that mean?
Well, I would say that when we talk about health, we often like to put it in boxes, right? Like the brain or the hormones or the gut. Um, but I love that conventional medicine can go so deep on each of those parts. But in my personal experience, we're not just disconnected parts, right? Healing doesn't happen in a silo. So for me, the thoughts can influence my biology, and my emotions influence my immune system, and my environment can impact my sleep. So at Neurosynergy, we look at it from a multi-dimensional perspective. So instead of just looking at something in terms of the physical symptoms that you might be experiencing, we're kind of zooming out and saying who you are is more than just your symptoms. And we're acknowledging the interconnectedness of how the emotions impact your immune system and your thoughts impact your body, right? So we use something called the quantum healing map, and it really explores those interconnected layers. And so form would be physical structure, your nutrition, your sleep, your balance in the physical sense that you're familiar with, your symptomology, right? Your flow is related to your emotions, not just what emotions you feel, but how much are you letting your emotions flow, or how much are you holding back? How much are you getting contracted versus how much are you expanding? And then there's awareness. So, awareness includes the way that you think about yourself, your life, your beliefs, your thought patterns. That's also where thought rewiring and cognitive retraining for memory and word finding and those types of things are. And field is your environment, not just your physical environment, like the room that I'm in right now, right? And the humming things that we were talking about, and all of the EMF and those types of things, but also our biofield, right? And how we connect to the relationships in our life, because your relationships are a field all their own. And each relationship you have with each different person is a different field all its own. So we tend to that. And awareness. And that really encompasses, I think it's the most important, because beyond your emotions, your mind, your body, your energy system, beyond all of that, I consider each of us to be your spiritual being. So recognizing ourselves as a soul, and how you honor your spiritual truth, which, my understanding is more like an ocean has like thousands of shores, and regardless of the shore that you're on, it's exactly perfect for you, right? That's your entrance to your ocean. Um, but honoring that. So when we say that healing isn't one dimensional, we're just acknowledging that human beings aren't one dimensional either. We're multidimensional. And for me and for the clients that I work with, shifting that perspective of just the what's wrong to what's in alignment, what's in harmony, what's in balance, and how can we kind of adjust that has been game changing. It's really kind of turned everything on its head and made everything more holistic and inclusive.
You mentioned before that it's like a puzzle. You got to put it all. You got to bring all the pieces together. So, are the pieces the thoughts, the emotions, the environment, and the spirit? Are they pieces of the puzzle?
Yeah.
So, let's say I've got thoughts and I'm constantly worried. I'm asking for a friend. I'm constantly worried about money. I'm constantly worried about business. I'm constantly worried about my family. How do those thoughts impact our emotions?
So your brain is the most powerful pharmacy. It's a lot powerful than any factory that manufactures drugs. You have the ability to create neurochemistry with the thoughts you think. So, based on the way that you just described that, you're creating a lot of like adrenaline and panic, and you're turning your nervous system on. And I would also say to that, hey, consider this: energy follows thought. So if I'm in my head and I'm going, "Oh my gosh, I have to get this done," and da 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 da, and what about that, and this thing, and that thing, and I'm not gonna have money, and blah 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 blah. What I'm bringing to me is more of that. I'm putting my energy into that, where I could choose instead to say, um, "This is what I'm gonna handle next right now. This is the next action that I can take to improve it." And don't look at the problem, look at where you're going. There's always going to be another problem to look at. I was just mentioning earlier, it's so similar to you've seen the movie The Martian with Matt Damon, right?
Mhm.
You know how he has this problem, this catastrophic problem, and then he like works really hard and he trial and error. He fixes this problem. And the minute he fixes that problem, oh my goodness, there's another big problem. Like, are you kidding me? There's always another problem. And at the end of the movie, what he says is so true and it's so profound. It's like in life, there is always going to be another problem. And instead of panicking, instead of going into crisis, just like, what's that next one thing that you need to do to get through that problem? And be kind to yourself. Be loving with yourself. Don't judge yourself for making mistakes or not being where you think you ought to be, because you know what? Where you're at is probably exactly where you're supposed to be anyway. It's probably absolutely perfect for you. Um yeah.
Once those thoughts start to trigger off those feelings and we start to attempt to regulate it, you were mentioning before that we could be in flow with our emotions. Um, what does it look like to be in flow versus emotional suppression or emotional repression? What's the difference?
It can look in so many ways. You know, for me, flow can be so many different things. Like, it depends on the way that I'm experiencing life that day. Sometimes flow for me is spinning in a circle. Sometimes flow for me is playing on my handpan. Sometimes flow for me is crying in my bathtub and imagining like all the bad stuff that happened that day is just going into the water and I watch it go down the drain. You know, sometimes flow is writing in my journal things that I would never have anyone read, but that I need to say them somewhere, right? Um, that that flow, that willingness to step into expansion even when it's uncomfortable, right? So That's so important for me because, you know, we're not really taught on this planet, in the world, in society that emotions are okay. We really, really are trained quite well how to tighten that up and buckle it down and not show it to the world. But, you keep pushing that down and it just creates a poison. And when you allow yourself to flow, and that can be a lot of things. It doesn't have to be negative. It doesn't have to be anger or sadness. It could be joy. It could be awe. It could be devotion, right? But allowing yourself the space in your own life to really experience all the layers and be okay with that, right? Instead of, I'm really upset about this thing and I just have to act like it's all good and nothing's bothering me. I see that so often. Like people that walk through the flames insisting nothing is on fire. I've been there, but it doesn't have to be that way. This is what I'm saying. Like it's always a choice.
Those emotions that aren't processed, where do they sit in the body?
Well, they sit in a lot of places in the body. Some of them will, and if you look at it from a quantum healing perspective, so the things that are in your body that you feel are actually not in your body to begin with. They actually are on the outer layers. So they were probably in your emotions before you had that physical symptom. And before they were in your emotions, they were probably in your mind, right? And before they were in your mind, they were probably in your energetic field. And before they were in your energetic field, they're in your bigger field. So if you view it like that and you don't allow your emotions to flow, if you stomp them down, quiet them down, shut them up, however that looks for you, you are pushing them in the body, and it might manufacture itself as headaches, as nausea, as a cold you can't get rid of, as depression, as anxiety. Like that's an infinite answer to that question because no two human experiences and levels are the same. So it could manufacture itself in a multitude of ways. It could be a shoulder that's out of alignment that no matter what you do, it won't get in alignment. You know what I mean? That could perhaps be a reflection of something that's happened to your life that was out of balance. And you've got to deal with the emotional underpinnings of that in order to really get to the root of your physical body and where it's out of balance. So really just like opening your mind to the possibility that it's not necessarily just the one thing it looks like.
Mm. People who are learning about the puzzle and the pieces, the physical, the emotional, the mental, the spiritual components, once they start to explore the spiritual component, what are some of those awakenings that they have? Because from my understanding, that when a child's born, there's a soft spot here on the head. And according to the chakra systems, that is their connection to the divine. And then by the age of 7, 8, or 9 months, those soft spots close, and energetically, that cord is severed, and they're no longer connected to the divine. And then most people live their life disconnected from the divine source until they have a health crisis or they come to the time of death. And that spiritual component, from my perspective, is they haven't explored it a lot. So once they start to explore that spiritual piece of the puzzle, what are some of the awakenings that they have?
Well, I would preface it to say that I'm not sure there's ever a time we're disconnected from the spirit, but there is a time that we're blinded by it, right? Blinded from it. Like the veil drops, the veil of awareness. I don't necessarily think that means that we're not connected anymore and we're just free floating. We're always connected. We just don't always have the knowledge and awareness that we are connected. And when people start to awaken the part of them that is more spirit than body, life can be really confusing because you start to look around and see the systems that are in place, the way that people do life. And when you look around at it, it doesn't match the reality of the spirit and what that is, in my experience. Um, and it can be a little jarring, right? It can give you a little bit of unsure about what you're experiencing. There's a lot of people that have physical symptoms. Well documented. When people awaken spiritually, they might have a lot of headaches. They might not sleep as well. They might feel more tired than usual. Um, but again, I know I keep coming back to it, but we're like how many 8 billion on this planet. So in my experience, we really experience that in 8 billion different ways. I just haven't seen it exactly the same for two people, a lot of similarities, but we're all unique.
Mm. I know from my experience when I started to focus more on spirituality, probably around about 2008, 2009, I started to have out of body experiences. And it was bizarre because I thought I was the only one having it. And then my flatmate said to me, he said, "Hey, have you ever heard of out of body experiences?" And I said, "What's that?" And he mentioned this word astral projection. And I was like, "Tell me about it." And I said, he told me about it. I went, "That's exactly what's been happening to me as I've been exploring these books." And I was reading books like Conversations with God and The Celestine Prophecy.
Mhm.
And I said, I was reading that Celestine Prophecy voice and that book. And then I said, that night I went to sleep and I laid down and I said, I could feel this vibration inside of my body. And I said, it was like I was inside an aircraft and we were about to take off down the runway. And I
Mm.
said, it was like my soul had temporarily left my body. And then he said, then what? I said, it was like I was looking down on my body in the bed and I could see myself sleeping. And I said, I'm an ugly sleeper. So we started to learn about spirituality. And from there, I became a lot more aware of my dreams. And the dreams didn't seem, sometimes normal dreams just don't make sense. Sometimes you dreaming, it's like the mind is going in there doing synaptic pruning, getting rid of some old memories, and it's just doesn't make any sense. It's just all this symbolic junk. But these dreams as I was having were real, and they weren't from this dimension. I was like, I'm in another dimension. I'm coming back with this information. And at the start, I was like, I don't want to tell anybody about this. I'll tell my mate, but I don't want to share it with anybody else because they'll probably think I'm a bit wacko.
Mhm.
And then as I started to do that, I started to explore other things like the tarot cards. And I started to learn about different parts of spirituality and more about myself. And I was in San Francisco and I walked into a new age shop and I got speaking to a gentleman and he described himself as a white monk. And I said, okay, white monk, that's interesting. Never heard of that before. And he said, you remind me of the moon card from the tarot. And I said, really? And he's never met me before. And he started to describe this card with two towers, a dog and a wolf, and this path in the mountains and this crayfish coming out of the water. And as he described it, I was like, okay, this makes a lot of sense. And he said, what's your date of birth? And I gave him a date of birth and he went through his book and he said, oh, the moon card belongs to you. I was like, wow. And then from there, I started to meet other people and went to many workshops and worked with shamans. And I realized as part of my healing journey that it was like my soul or my energetic body had some scars in there
Hmm.
and it was holding on to traumas and things that I'd worked with consciously were still there. I was like, wow, this is interesting. It's like the energy was out of alignment.
Mhm.
And as I started to heal that energy, those rifts, I got more mental clarity. And when I had that more mental clarity, I had more emotional balance. I
That's
could, like
right.
you're saying here, I could express the emotions. And later on in life, I learned that people can be in flow. I learned that people suppress and also repress emotions. And I think, like you're mentioning here, those people who walk through the fire saying, there's no fire. I would feel an emotion, but I'd say, I don't have time for that right now. I don't want to handle that right now. And I'd bury it. And then I do it consciously. And then after a while, I realized that I wasn't even doing it with conscious awareness. And over time, suppressing and repressing those emotions, I started to feel like an emotional numbness. And it was like there was nothing there. And that was interesting as well. But it was all part of that spiritual awakening, becoming aware of different parts of my mind and my body and how they interconnected together. And once I had balance in all areas, life got better. Where before I might have just focused on physical health and disregarded the mental health. And there was never a balance. It was always, it's like a teeter-totter, I think you call them in America. We call them a seesaw in Australia. There was no balance. It was interesting. When you're working with your patients, what's a common scenario that you work with that often gets overlooked by other specialists?
Well, I'd say that I often meet people that, you know, go to this provider for this organ and they get treatment, but it's not helping. Um, they're not getting relief. They've tried a lot of different people, a lot of different paths, but something is, still not working. Um, for me, I had, as I mentioned before, um, my thought patterns influence my physiology, right? So not only did I have to look at the routines that I needed to build and the exercises that would be good for different areas of my health and well-being, but I also needed to re-examine what are my beliefs about health? Because if you really think that you're sick, how are you going to create health in a consciousness that is holding on to this idea that you're sick and there's something wrong, right? Energy follows thought. So health for me um, is including all of that. And the people that I work with, they feel like they've not been heard, right? They've gone to all these different people and they've tried to get help in these different ways, and no one's hearing them. No one's really seeing them. And I guess
Is
because,
is
yeah,
that a systemic problem
hmm I
because
would,
of the
yeah,
the duration of a consultation? 5 minutes with a doctor versus
you know,
20 or 30 minutes?
it's really the way they're trained. It's not only just the way they're trained, it's the system. It's that where healthcare used to be an institution that was focused on the health and healing. I work in healthcare, and everybody that I know that works in healthcare, we all say similarly that now healthcare is less about health and more about the dollar bill. And it's become more of a financially driven thing with all these productivity margins and efficiency margins. And, the physicians that people are seeing are under the gun themselves for, I have this much time to spend with the patient and I have to do this pre-authorization. And, so I wouldn't say it's like just one specific thing. I'd say that it's yes, it's a systemic problem.
Hmm. Sorry to break your train of thought. The
No.
reason I brought that up was I was having some problems with my back, and it was a problem that lasted for 6 months, and that's the kind of the longest health crisis I've ever had. I've
Mm,
had PCLs removed out of my knees. I've had knee reconstructions, and the pain kind of come and went really quickly. And I was in rehabilitation. The pain disappeared, but this back problem stuck around. And I remember putting up with the pain and trying everything that I could do. I'll sleep on this side of the bed. I'll sleep on the other side of the bed. I'll raise my legs. I'll put them down. I'll stand up. When I work, I won't sit down. And then I went to the back specialist. And so here in Taiwan, our medical system is pretty good. Uh, I booked the appointment on a Monday. I was in there on the Tuesday. And I went in, and the consultation went for 3 minutes. The doctor did their job: examination, diagnosis, prescription, in 3 minutes.
Mm.
And exactly what you mentioned there, I didn't feel heard. I wanted to be able to explain the situation, but it was examination, diagnostic, prescription. So after 3 minutes, I was out of that room, x-rays, coming back in for the final prescription.
Mhm.
And I was like, but you didn't hear me out.
Yeah.
And that was a frustrating. You didn't hear me, but I didn't blame the doctor. I'm looking at the system.
Yeah.
There's 50 other people waiting,
Mhm.
and they're just pushing them through. And so by the time I got out the other side with the prescription, I'm not taking your medicine. I ain't going to that physio because I don't even understand what you told me,
Mhm.
but I don't think it's a match for what I think it is. So exactly what you're saying there. I didn't feel heard.
Yeah, and I've had things other than brain injury that I would say a similar thing to, where I had gone to doctor after doctor after doctor, piecemealing it out, not getting an answer. Like, okay, we've got a PhD in integrative medicine. Let's just figure it out ourselves then, right? To only find that, like, there's a giant missing piece, right? So, like, a shoulder injury that was chronic was being driven by a hypermobility syndrome issue. So I went to doctors and doctors and doctors. They kept trying to fix the shoulder, but nobody looked at the underlying hypermobility issue. So when you have hypermobility, your proprioception is different, which
Mm,
that word just means like the way you relate to your body in space, how far you can push it or how far you shouldn't. That parameter is kind of lost. So of course you're going to continually injure it if you're always overstretching it, right? Um, I would have loved it if someone would have listened to the symptoms and done a little bit more looking, right? Instead of just shot every 3 months. We're going to do a shot every 3 months, and here's this page of exercises that we want you to do. And when it didn't get better, kind of being looked at like you didn't do the exercises. But that wasn't true because I did do the exercises, like more than most people do the exercises, like I have this to a schedule. I have an alarm that goes off to tell me which exercises to do on which day. I did do them, right? But if there's a hypermobility problem, then all your exercises are going to have me do is overextend in the wrong direction and make the problem worse. Oh my goodness, right? Um, yes. So what I'm trying to do is I just want to say, I see you, right? I don't just see your back pain. I want to know what's driving the back pain. So it's not usually just about the back. And it's probably also about the other parts of your body and the way that you carry the weight of the world and the way that you carry your body through life and the way that you present yourself to life and the way that you hold yourself up. Like, there's so many subtle layers there that aren't physical, but they're just as important. And
mhm,
in my experience, they all contribute, right? They all interlock. It's not that healing is a puzzle and there's only 5 pieces, and each of those is like form, flow, essence, or whatever. It isn't like that. It's like we're all each our own 3-dimensional puzzle, and we each have our own variation of how much of that puzzle is more focused on form and how much of your 3D puzzle is more flow. And your percentages probably aren't what mine is, but that's the beauty of being human, right? Is that we can all be unique and different. And that's a beautiful thing.
mm. I visited another couple of extra doctors after the first one. The second doctor, I think, was newer. And so this doctor had less patients to see. So when I sat down, the consultation was for 15 minutes. And what I found with the second doctor, it was more interested about me as an individual. Okay, so Daniel, You're a white guy living here in Taiwan. Are you on holidays? No, I live here. How long? 14 years. Okay. And what do you do? Got kids. Okay. And what do you do with your time? I've got a business. Oh, how's business? I lose my hair over it. Oh, interesting. Okay. Let's talk about that. And before he got into the diagnosis, it was just a really long examination beyond the physical. It was mental, emotional, and spiritual as well. And then he looked at other areas of the body. And I went back once, went back twice, and didn't find resolution. But through that talking, through being heard, I was learning more about my own situation. Because the story that we tell ourselves on the inside, when we speak it out loud, can sometimes sound really wacko. Like you listen to it, go, that's not how it really is.
Mhm.
Or sometimes you speak and go, yeah, that's exactly what's happening. And so I went to another doctor, and he probably spent about 25 minutes with me. And he was a more to do with sports. So we talked about different things, and then he gave me some acupuncture. And he put one needle in one spot, and it was like hitting the bullseye on the dart. And I went,
Mhm.
ah! And he said, now how do you feel? I said, that hurts, but it feels good automatically.
Mhm.
So I went back, and the pain came back again, and they gave me an injection on the next time. And the injection probably worked for about 5 minutes. So I went to another doctor, and I went to a Chinese medicine doctor, and we were looking at different things. So now he's incorporating sleep. Okay, tell me about your sleep. What time do you go to bed? What time do you wake up? Are you drinking hot drinks or cold drinks? No, cold drinks. Okay, stop drinking that. Are you drinking this? Yes, stop drinking that. Are you eating this? Stop eating that. And then he gave me some acupuncture. And the acupuncture probably was a bit too sensitive for the pain in my body. But I kept going back because we were exploring different parts. And then one day I was watching a podcast, and they were talking about creatine. And they were talking about megadosing creatine. Normally, creatine is a dose of about 5 grams per day. And some of the doctors were recommending up to 20 grams a day for full muscle saturation. And I thought to myself, what if it's not all of those problems? What if my muscles were just really dehydrated? And the reason why I say that is here in Taiwan, we get very high temperatures. So through summer, nighttime might not get below 35 degrees Celsius. And then in the daytime, it's up to 40. But then you've got this really high humidity. So it's like the water and the blood boils. I thought, let's try some megadosing of creatine. I megadosed on creatine. First day, 20 grams, pain disappeared.
Hmm.
But I had to go through all the other bits and pieces. And
Mm.
I'm not saying that it wasn't valuable. It was all
Right.
valuable, but it kept me in that mode of exploration. I'm still looking for an answer. I'm still looking for a solution. And then it was like a compound thing. I still go to the Chinese doctor. I still went back to the other doctor. But then the muscles seemed to absorb the water. And I was like, wow. So then I megadosed on creatine, and now dropping it back. But it was a puzzle. And it was not
Absolutely.
one size fits all. It wasn't
That's
like
right.
taking just one thing off the shelf and saying that's going to fix you. It was many different components layered in. And
And
so,
it was your persistence and your openness to consider other possibilities.
yeah, well, I had the spiritual healing. I did the praying. And I also explored the different types of thoughts. And my mum said to me, she said, Daniel, have you been looking at the Robbie chart? And I said, I have been. She said, your hip, do you have fears of moving forward in life? And I said, I do. And she said, well, you better deal with that. I said, okay. When it all of us need to sleep. And, I think we can live longer without food than we can without sleep. And in the Western world, I think the importance of sleep is still yet to be recognized, where here in the Eastern world, it's very important. The difference here in the Eastern world, if you're caught sleeping on the job, you're an excellent employee. If you're sleeping at your desk, you're committed to the company. If you're on the floor curled up in a ball, you love your job. And that's how it is here. So you can sleep anywhere here. People go to Starbucks and they sleep in Starbucks. You go to the restaurant, You sleep in Starbucks. People don't look down on you for sleeping. I have seen people balancing on a chain fence,
Mm,
sound asleep. And it's so different because in Australia, we wouldn't do that. If you were caught sleeping on the job, the boss would be like, "You're hungover, go
mm,
home.
mm.
You're not committed to the job, go home. You're not committed, here's a warning." So our philosophies on sleep are different. From your perspective, how important is sleep when it comes to healing and overall health?
Oh my gosh, it's really for me, it's the foundation. Sleep is 100% more important than most people realize. Um, when you sleep, your brain goes through something akin to a deep clean cycle where your lymphatic system cleans out the environmental toxins, plaques, things that you've acquired throughout the day that you don't need anymore. And when people don't sleep, their cleaning crew gets interrupted. They're going to wake up with brain fog. They're going to have more fatigue. Aside from just the organ of the brain and that cleaning cycle, your organs and every cell in your body has an opportunity to clean, to recharge, to rebalance in those sleeping time, right? When the body is at rest, when everything is relaxed, it cannot be understated. And I often tell the clients that I work with, especially once you've experienced a brain injury, you no longer have the luxury of not sleeping. um, it is paramount. I That's probably like the number one thing that's important for me to keep up with on a daily basis. Yes, there's many things that I could talk about, but if I don't sleep and my brain hasn't cleaned itself, I'm not the same person that you're speaking to now. Um, because I've sustained so many brain injuries, if I don't sleep very well, sometimes it can be hard for me to communicate and think and put my words together. And a lot of people laugh and they're like, "Yeah, Sarah, that's not just you because you had a brain injury. That's literally everybody." When we don't sleep, our brains, they don't function properly. And that's probably also true. But because I work so intimately with that population, it's very different status post brain injury for me and for all of those people. People that are working on getting their words back and they make a ton of progress, but then they go one night without sleep and they have therapy the next day. They're like, "Oh my gosh, why can't I think of any words? Why can't the words come? Why do I have more speech problems?" It's like, you didn't go backward. Healing is not an up, it's not just like straight uphill like we want it to be, right? People are in this society where you can order something on Amazon and it's there in 2 days. Healing doesn't work like that. It's not on that type of schedule. It's more about you being persistent and you being online, for yourself. Sleeping is the difference for me, is the difference. You gotta prioritize your sleep. You gotta prioritize your cellular renewal. That's an opportunity for your body to have a better day the next day. So don't miss it.
In our family, we prioritize sleep. Our children, my son, he's in bed at 8 o'clock in the morning and he gets up at 6. So he's getting a deep sleep every night. My daughter, who's almost 13, she is in bed by, we'll call it 9 o'clock, and she's awake at 6 in the morning. And they are healthy, strong children. They're also the top students in their class. They're always getting the top grades. And people ask us all the time, where do you send your kids for tutoring? We say, we don't. They say, but all the other kids, they leave school at 4 o'clock and they go to what's called a bushy barn, a tutoring centre here. And these children will study from 5 o'clock till 10 or 11 o'clock at night.
Mm,
And I'll say, my kids are asleep.
mhm,
And they say, why? I said, because we prioritize sleep. If you want to have great short term memory, you need a lot of sleep. If you
mm.
want to be able to recall and have great long term memory, you've got to be able to sleep.
That's right.
They said, why are your kids bigger than everybody else. I said, well, I'm Aussie, but they sleep. And the growth hormones are released in the sleep. The body does its recovery in the sleep.
That's it.
And our children wake up in the morning and they're good to go. They're ready to go. I've never had to ask them to study. I've never asked them have to do their homework because they got the energy. And it comes down to the sleep. And it's the sleep architecture. It's for us, it's the preparation for sleep, making sure that we're fed. We like to live by the Chinese organ body clock. We like to eat our meals for dinner at 5 o'clock because
Mhm.
we know if you're going to bed on a full stomach at 8 o'clock, that's not healthy. Yes,
Mhm.
you might get the triple burner effect. All the big organs might be burning, but you're going to wake up at about 1 or 2 o'clock in the morning. So our children sleep through. I also find for myself with emotional management, I learned by studying the Chinese organ clock that we release the emotion of grief between about the hours of 3 and 5 o'clock in the morning.
Mhm.
And that's the peak time of the lungs. And what I found was if I could sleep through that, any of my griefs were resolved.
Mhm.
And for business people, you might think, I don't have any grief. I don't have any sadness. Well, let me tell you this, you've got a goal and you haven't achieved it. And every time we set a goal and we don't achieve it, we grieve the loss of
Mhm.
that goal because we distort the future. We say, this is the future that I want. This is the goal. This is the money I'm going to make. I'm going to buy that car, buy that house, put my kids into that education. And when you don't achieve the goal, you grieve the loss. Now, the body has to be able to process that. But if you can't sleep correctly, then you're not allowing your body to naturally release the grief. And then what I also
Absolutely.
found was the peak time for our large intestine. If you sleep really well, then your bowel movements also get better. And people
Mhm.
who have been constipated for 10 or 20 years who just start to sleep good, they get excellent bowel movements. All those bonuses of sleep. To improve our overall health, you also talk about the power of sound healing. How do you use sound in healing?
That's a great question. So, we're made up of vibration and sound and light. You can measure it. And some really good ways of thinking about this is vibrations want to be in sync. Okay. You want to be in sync. You're designed to be in sync. And some examples that you could think about are like from physics. If you take a group of metronomes and you set them all off at different times, right? But you leave them there. It just takes a few minutes, and then before you know it, exactly right, they're all going together. That's it. Another example of this is people on like a swinging bridge. They all eventually march together. It's just something that happens. It's coherence, right? It's resonance. So, when we're talking about using sound therapy and healing, what we're really talking about is that we're bringing the body into harmony, into balance through vibration. So, there's a lot of ways of doing that. You could use tuning forks or singing bowls or gongs, or there's so many things, hand pans. You could do humming or drumming, or that's the beauty, right? Is there's a lot of options. And maybe the thing that strikes a chord for you and brings you into rhythm and balance is different than the thing that brings me into rhythm and balance. And I'm pretty multidimensional myself. So I don't just use one way. Sometimes I'm using my tuning forks, other times I'm on my hand pan, sometimes it's my singing bowls. It could be, different frequencies that I'm using. Um, but it's all about bringing the different layers of who we are as a multidimensional being into coherence, into harmony, and into balance.
Hmm. Sound has been used for thousands of years
Mhm.
for healing. And I think a lot of us underestimate the power of sound. My son, Caesar, we were watching the Olympics that were in Paris, and Celine Dion, I think, was singing. And he said, "Dad, can you turn that off?" And I said, "Why?" He said, "It makes me feel depressed."
Hmm.
And that was a 7-year-old. And it was just the sound of the music.
Mm-hmm.
Now, there's other songs that my children listen to, and they'll be hyped up. They'll be totally hyperactive, like they got ADD, ADHD. They're flying around the
Mm-hmm.
house. They're jumping off the wall, jumping off the couch. And it's just sound, and it changes their emotions. It
Mm-hmm.
changes their physiology. And I think all of us, we have a favorite song. For some of us, we like maybe a little bit more sad type music, and it'll change your emotional state. And then we have that song from the 2000s that lifts us up automatically. It's powerful. Ninny and I and our children, as part of our sleep architecture, we use sound frequency immunotherapy tracks every morning. So when we wake up, we put our protocols on to bring our mind, our body, our soul into alignment. So at 6 o'clock, I walk out into my lounge room and my kids have got their headsets on and they're listening to their sound frequencies. And also, as part of that sleep architecture, before they go to bed at night, they're listening to their sound protocols for at least 15 to 20 minutes before they go to bed. And it's interesting to observe their sleep latency is that their head hits the pillow and within seconds they're asleep. And it was like that McClintock effect, that brainwave entrainment, that frequency following effect. Those frequencies prepare the mind and body to sleep, but also prepare it for the day, to take it out of that sympathetic nervous system response back into parasympathetic dominance. And it's interesting to see it. I even know for me, if I miss a night of my sound frequency protocol, I'm like an addict. I'm like, oh, where's the protocol? I better put it on. I'm missing it
Mm.
because I know the difference in my sleep. I mentioned Christopher Bellamy just before. 2.5 years ago, he was diagnosed with a brain cancer. He had radiation and chemotherapy. He had his light sensitivities for 2.5 years, and he had his sound sensitivities also for 2.5 years. And we gave him a healing protocol. And in that protocol was some specific frequencies to bring his brain back into balance. And after 4 days of listening to the sound frequency immunotherapy, he messaged me and he said, "You wouldn't believe it. My sound sensitivities have stopped." He said later that day, he said, "You wouldn't believe it. My light sensitivities have stopped." So listening to a sound therapy protocol for 15 minutes a day enabled him to rewire his brain. And he took off the glasses and he hasn't put them back on. He took out the earplugs and he hadn't put them back in. And I believe that the future of medicine and healing is going to come down to sound. We already use sound to detect imbalances in the body, and we can also use sound to correct them. And it's phenomenal for people to experience the power of sound. And I know for myself, it works wonders in my life.
Yes.
Such a special thing. What do you see for the future of healing? Where are we heading?
You
Or what
know,
do we need to get to the right place?
I really feel that if we're gonna do it, we've got to stop chasing symptoms and putting band-aids on, and we really gotta get down in there and get real about the complexity that is health. And I really think that instead of being a reactionary model of health, what do I mean by that? I mean, people get sick and they go to the doctor, and that's when they see the doctor, and the doctor comes in at that time of crisis, right? I would love to see us turn the page and us be more proactive instead of reactive. So what does that mean? Well, I really have the intention that I try to teach as many people as much as I know about how to be advocates for their health, how to learn how to keep themselves healthy. That way they don't need a doctor, you know? Um, I've heard it said in other countries that you pay the doctor to keep you healthy, you don't pay them when you're sick. I don't know what country does that, but it's really always just really struck with me because that's not how we do it in America. When you get sick, you go see the doctor and you pay the doctor to give you medicine, or you might need a surgery or something like that. But there's not as much attention and time and effort and energy on how teaching people. Like, in an ideal world, I would do it the way you're doing it with your kids, teaching them from a very, very young age how to master their biology and all the levels of experience and how to bring themselves into balance and resonance. I would like us to live in a world that we don't have to go to the doctor all the time and we're not always in a reactionary, focused on chronic disease and illness mode. I would like to see a world where we're more focused on health, balance, and resonance. And, I don't know if it'll happen in my lifetime, but I'm not going to stop until I can just put my put my little bit in there.
Dr. Sarah, thank you for being here with us today and sharing your wisdom. Thank you so much.
Thank you so much.